Could you trust a robot with your life? I know, it sounds like something out of a sci-fi movie, but it's a question we're all going to have to answer sooner than we think. Today, we're diving into what it really takes to put our faith in artificial intelligence when it comes to our health. So let's just put it out there. Your doctor comes in with a diagnosis, but they didn't make it. An AI did. How do you feel? Do you trust it? This isn't some far-off future scenario. This is happening right now in hospitals all over the world. And to figure out how we're all grappling with this, we're looking at a huge review that pulled together the findings from 40, that's right, 40 different studies. All of them were trying to answer that exact same question. What makes us trust medical AI? Look, AI is already making waves, from assisting in surgery to spotting diseases on scans way earlier than the human eye can. But honestly, none of that amazing tech matters if patients and doctors don't actually trust it. At the end of the day, trust is the real bottleneck here. So how do we get there? Well, the research points to three big ideas. First, we've got to peek inside that so-called black box. Then, we need to look at our own psychology, the human side of trust. And finally, we have to ask a very practical question. Is using this AI actually worth it? All right, let's kick things off with part one, understanding the black box. This is all about what researchers call AI literacy. And this quote from the research really just nails it. You can't build real, lasting trust on blind faith. It has to come from a genuine understanding of how these things work, not just, crossing your fingers and hoping for the best. So this idea of AI literacy breaks down into three pretty logical steps. It all starts with acceptance, which leads to understanding, and the final goal is what's called explainability. Let's walk through them. Step one is just acceptance. Before we do anything, we have to believe that AI is even worth our time. That means it needs to be accurate, it needs to be reliable, and of course, the stakes matter. I mean, think about it. You're going to demand a way higher standard for an AI diagnosing cancer than for, your robot vacuum cleaner, right? Okay, so once we've accepted it's a possibility, we move on to understanding. Now, this doesn't mean you need to become a software engineer. Not at all. It's about knowing the main ingredients. What kind of data was this AI trained on? And, maybe even more importantly, what are its known limitations? What can't it do? And that leads us to the final crucial step, explainability. The AI can't just spit out an answer. It has to be able to show its work. It has to explain why it made a certain recommendation. This is absolutely critical if its conclusion goes against what a human doctor thinks. That explanation is what turns it from a mysterious black box into a real partner. Okay, so understanding the tech is obviously a massive piece of the puzzle. But what about us, the humans in this equation? Even with the best tech in the world, our own psychology plays a huge role. And that brings us to part two, the human trust factor. Well, it turns out our backgrounds and experiences really shape our attitudes. The studies consistently found that, generally speaking, men and younger people tend to be more trusting of AI from the get-go. Same for folks who are just more comfortable with technology in general. On the other hand, women, older individuals, and especially anyone who's been burned by tech in the past, well, they tend to be a little more skeptical. Where do you see yourself on this spectrum? But here's the really fascinating twist in all of this. Most of the time, our trust in an AI isn't really about the AI itself. We trust it because we trust the people who tell us to. Researchers have this great term for it, the cascade of trust. It works like this. You, the patient, trust your doctor. So if your doctor says, hey, this AI tool is really good, you're much more likely to trust it too. And why does your doctor trust it? Probably because experts they respect have validated it. See how that works? Trust flows down from a trusted human source to the machine. So let's recap. We understand the tech, we're psychologically on board, but there's one last, very practical hurdle we have to clear. Is this AI tool actually useful? Is it worth the effort? This is all about what the research calls AI utility. So what makes an AI system useful enough to earn our trust? Well, it really boils down to three main things. As you can see, the biggest slice of the pie, at a whopping 50%, is just perceived value. Does it actually help? After that comes privacy and security. And then, surprisingly, it actually helps if the AI has some human-like qualities. But here's the thing. Value means different things to different people. For doctors, value is about making their jobs easier, reducing their workload, and getting more accurate results. For patients like you and me, value is about convenience, knowing our data is safe, and most importantly, getting better health outcomes. For an AI to succeed, it has to deliver value to everyone involved. And we can't forget those other two factors. Rock-solid data security is just non-negotiable. And that other piece, giving the AI some human-like traits, it sounds a little strange, but making an AI feel more like a friendly assistant than a cold machine can actually make us more comfortable and willing to trust it. So we've looked at the technology, our own psychology, and the practical value. Now let's put it all together and see if we can come up with a simple trust equation. This is it. This is really the core takeaway from all 40 of those studies. True sustainable trust in medical AI isn't just one thing. It's a formula. It's the sum of a clear understanding of the tech, an appreciation for our human factors, and the delivery of real, tangible value. You need all three. So in the end, as AI gets more and more powerful, the big question isn't really about the technology's capability anymore. The tech will get there. The real question is about us. It's a human challenge. Can we learn how to build systems we can truly trust? And can we, ourselves, learn to trust them?